Hi, my name is Karen, and I'm a clinical nurse specialist at the James. Here's some information on how to take care of your catheter when you go home. After your prostatectomy, you will have a catheter in your bladder for 5 to 7 days to let your urethra heal. Most people have the catheter removed in the clinic. Some urologists have you learn how to take the catheter out at home. A nurse will teach you how to do this before you leave the hospital. You can see the balloon here that sits in your bladder. Your catheter will be connected to a urinary drainage bag. Every urinary drainage bag has its own spout. This drainage bag has a spout that toggles back and forth to lock it. Make sure it's closed before you put it back into the spout holder. It's important to wash your hands before you touch your catheter and your catheter bag. When you're at home, you may want to exchange your catheter bag to a smaller bag so you can go out and do daily activities like go to the grocery store or library. I'm going to show you how to exchange the bags now. You're going to get all your supplies ready. It's nice to have a towel down just in case you have some drips. This is an example of a urinary drainage bag for the leg. It's a smaller bag that can be utilized when you want to be more mobile. There's a cap at the end of the catheter port. You'll make sure to take it off. Then this flat end goes towards the tapered end. You'll want to make sure the connections are tight so that urine doesn't leak out. Once you have your leg bag ready, you'll just unplug from the larger catheter bag. You may have to twist it a little bit, but it's usually on from friction. So it comes off easily like that. And then you'll take the other tapered end and kind of twist it on until it's secure. There's no threads or anything, so it'll be held on by the rubber. With both the leg bag and the larger drainage bag, it's really important to keep the bag below bladder. If these bags are raised above the bladder, all the urine that came out of your bladder might backwash into your bladder, causing risk for urinary tract infections. With the leg bag, you'll want to secure this to your calf or your lower leg. One strap can go on the upper part of your calf and the other strap can go on the lower part of your calf. On this leg bag, you'll notice that there's a drain spout. This one twists open to open and close. After you're done with your day activities, it's important to switch from the leg bag back to the larger drainage bag. You'll want to change back to the larger drainage bag when it's time to go to bed. Make sure you wash your hands, get everything ready, and go ahead and twist the catheter off. You can save the drainage bag, the leg bag, for another day, and go ahead and twist the larger catheter bag back on. When you're not using the catheter bags, you can store them in a clean, dry place. There are also instructions on the Home Care for Your Foley catheter handout on how to wash and clean the catheter bags when not in use. For comfort, you may want some lubricant around the penis tip, such as KY jelly. You can shower with your catheter in. Just make sure when you shower to wash around the catheter site once or twice a day, and you can wash all the way up the catheter. You will be discharged from the hospital with a catheter securement device. Some look like this, which is like a band that wraps around your leg, and the Velcro kind of secures itself over the catheter, just like this. And some people have a securement device that looks like a sticker that attaches to your leg. Call your doctor's office if you have the following problems with your catheter: burning or pain in your lower abdomen, pain or aching in your back around the area of your kidneys, chills or a fever of 100.4 degrees or higher, pain, redness, swelling, itching, or burning near or where the catheter leaves your body, feeling that your bladder is full or that your catheter is plugged, urine that looks bloody, dark golden, or cloudy, if your catheter is not draining urine, confusion or changes in how you act, or if your catheter falls out.